There are strategies and tools that we can use. One, of course, is we can use our own clinical experience. And then if there's an obvious contradiction between what a person is reporting in their interview and what you observe, then that basically is one way of maybe raising the issue in your own thinking that this person may be malingering or faking in some way. For example, if a person reports being sad basically all the time, every day of their lives, but when they come in and talk to you, they do not have a sad affect. They're laughing, they're joking, they report positive stories. Then you have to really question, whether they're being straightforward and reporting their depression, because there's the contradiction that you see and that you observe, in your clinical interview. One way that I like to use, one technique that I like to use in trying to pick up on whether people are feigning their symptoms or not, is to give a structured interview. And we'll talk about, there's all kinds of structured interviews where there's a list of questions that address different diagnostic categories, and they're short questions. And so if I give like 10 minutes of a structured interview at the beginning of my interview, and then maybe 3 hours later, where again you're asking them in a rapid fire session 40 different questions about their symptoms. If in fact they report differently on those 2 administrations of these tests, then you have to raise in your own thinking the question about whether they are faking or not faking. We're very fortunate that we'll talk about this test here in some detail in a little bit, of having a great tool, the Rogers-Surs test, which is a structured interview for reporting symptoms. It is a great tool. It is a major tool with all kinds of validity that goes behind it, that supports it. It's a great tool to use in order to be able to come to the conclusion that somebody is malingering, exaggerating, or faking. And we'll talk about that in some detail here in just a little bit.